Opposition parties are criticizing the BC NDP government after the health minister announced a plan to send some cancer patients to the U.S. for radiation treatment. Both BC United and the BC Greens say the move shows our healthcare system is failing.
I think people are going to be shocked to find out that not only will they receive a cancer diagnosis, but they will likely need a passport in order to get the kind of treatment and care they deserve to have closer to home here in British Columbia.
The first thing that comes to mind really is having been through cancer in my family, the separation from family, from community, from support network, from home adds this huge additional burden and stress to people that are already facing really difficult and challenging situation.
Adrian Dix announced on Monday that starting May 29th, eligible breast and prostate cancer patients will be offered radiation therapy at one of 2 Bellingham clinics. He said up to 50 patients could be sent to the Washington State City each week, all expenses paid, to reduce wait times.
Many of our regional cancer centers are undergoing or are planning for their linear accelerator replacements. During replacements, the other machines need to run for further extended hours. This fact, coupled with non-standard work hours and shortages of key personnel in radiation oncology, puts pressure on our cancer treatment resources.
Michael Carter, a University of Toronto professor who researches healthcare planning and forecasting, says BC is one of the worst provinces when it comes to wait times for this treatment.
The Canadian average is like 97% of Canadians get their radiation therapy within the recommended 4-week guidelines. BC is below 90%.
He adds Canadians going to the U.S. for healthcare isn't new. In the past, Ontario has sent cancer patients to New York State.
It's not good. It's probably, it's certainly better than just waiting until we hire the staff and hire the people we need, right?
Dix says the temporary program will be in place for 2 years as the province addresses staffing challenges, but both opposition parties say more action is needed to address the healthcare crisis.
These measures that the government are taking are necessary. People need to get treatment. People need to know that there are steps being taken. But until we can have a really honest assessment of what got us here, we're going to keep getting the same results. We're addressing the symptoms, not the causes.
We have a full-blown healthcare crisis in British Columbia, and it is time for the government to acknowledge that that this is a significant issue. It is on their watch, and British Columbians deserve so much better than this.
In Vancouver, Monika Gul, City News.